We're running the gamut here pretty good, I think. But I would like to get back to Social Security and Medicare. The Medicare prescription program, is it working or is it not working? What's your feeling on that?
Well, I'm not on Medicare yet, so I don't know from firsthand experience whether it's working. But I can say that the folks in my constituents and the folks I've talked with express a concern. As you've heard and I've heard, we've all heard the war raging in Washington about access to health care. We've heard the Hillary Clinton plan. We've heard various versions of national health care being proposed. But the number one issue to every Montanan when it comes to health care is quality. They want to make sure that that doctor and that health care professional that's giving them care is high quality. That's the first thing you think about when your family member goes in for surgery, is quality of the doctor. The second thing that comes to your mind is affordability. Can you afford that health care? Well, what's happened with this entire Medicare mess, the federal government stepped into a situation, again, to manage health care, and what's happened? Has it gotten better or has it gotten worse? And I would say that the cost of health care to the consumer has gone up artificially in places that it shouldn't have, because hospitals now have to require more regulatory controls, they have to deal with more paperwork, and it's become much more difficult on providers. So I think that Medicare Part D change that they did, one of the things that they did is they put a larger burden onto states to try to ultimately pay for those programs. And I think that's a mistake, because state governments just can't afford the degree of budgetary weakness that Congress has done. And I think that's a big issue.
Okay. I'd also like to get back to our